Well, there's more COVID vaccine confusion, and of course, as we've seen in the past, confusion leads to hesitancy. Why is the federal government and the vaccine manufacturers doing this? Let's talk about it. Hey, everybody, it's Dr. David with another Ask Dr. David episode here. And of course, as you can imagine, I am getting a good number of questions relating to the different recommendations, the different things we are hearing about the new version of the COVID-19 vaccine that is now covering for BA4 and BA5 spike antibodies. Now, I know I just made a video not too long ago on this, but with as much confusion as what's going on and as much information that's coming out, I did think it would be important to try to keep people as up to date as possible because of course we are all about people making informed decisions, giving people as much information as they possibly can in order to make the best decisions for themselves and their families. Okay, now first off, in follow-up to my last video, and I did decide not to don the mouse ears this time, but we have learned that a grand total of 8 mice were studied prior to the federal government, the FDA, giving the authorization and the CDC passing through the authorization for the new Omicron-derived, Omicron treating, supposedly, vaccine. And 8 mice. So I probably 8 mice would be enough to see if the antibody levels go up. But there's more to this because, there is no evidence whatsoever that this works in humans. We suppose it will, but there's no direct evidence. Yes, it did go up, as I mentioned last time, in the previous new version that never came to market in America, for the BA1. But of course, at least we were smart enough here to to aim for a vaccine that is actually going to provide protection against that which is in circulation right now from the wild virus. Because as we've talked, there is no more BA1, just like there's no original COVID strain either. Now, what they did with these mice is they saw the mice antibody levels go up. They did not check anything with B cell, T cell memory cells. They did not show anything that would talk about efficacy in terms of does it stop the mice from getting sick. Now, as we had also talked about, there had been one study that was done on BA1 spike protein. Um, but again, only antibody levels were checked, but at least that was in humans. Now, of course, wasn't a large enough sample size to make sure that everything would be okay in terms of any types of side effects, and there was absolutely no research done on whether the intended goal of the COVID vaccines of Operation Warp Speed, which was a 50% reduction in death or hospitalization, there's no evidence that that is actually going to happen or that it's happened. Let's face it, 90% of people, at least adults, have antibodies, have some level of protection against COVID-19 at this point. And we're dealing with a more mild version. And so, will we see a reduction in hospitalizations or death? I guess we will find that out. But of course, people are being vaccinated without knowing that. So, as I had said before, I think waiting, a month or two to at least see if there's any data that comes out to see whether it's helping people along may be a prudent thing, and especially for people who have prior immunity from vaccination or from wild disease. Okay, next. Now, since the vaccines have actually started to be distributed, a whole another issue came out. And now that it's in doctors' offices, pharmacies, vaccine centers, etc., in that we have now seen that the vials are very similar for the this new booster version compared to the original vaccine. Okay. Now, there's a lot of concern amongst a lot of doctors now in terms of the potential of this leading to drug errors. Now, drug errors happen a lot, way more often than it should be. But whether it's wrong prescriptions are handed out in the first place, whether it's the wrong doses that's given, whether drug interactions haven't been checked, whether it wasn't checked to see if a person had a negative reaction to a similar medication. This is the problem. And now, so here's what we found. So for the Pfizer vaccine, which is again, this vaccine, this booster is approved for people who are 12-year old and above. It comes in a vial that is a gray cap with gray labeling. That's the exact same color scheme as with the original vaccine. And that's, of course, still being offered to people because the booster is supposed to only be given to people once they've had 2 doses of the regular original vaccine. Now, Moderna's updated booster, which is just for adults, it has vials that come with a dark blue top, the cap with gray labeling. But the vaccine that was made that they're doing for ages 6 to 11, which was the original formulation, but for the younger, so the smaller dose, also has the same blue cap. Who could imagine that somebody could grab the wrong look at, oh, there's a blue cap, I'm going to grab that. So, yeah, but at least this time, with one thing that's different is that the vials for Moderna's original vaccine for adults was a red cap. Now, the wording on the labels itself does state which vaccine it is, but what the hell were the manufacturers thinking about by making these things so close? Do they not have the funds available to make a red cap or a yellow cap or a blue cap? Maybe we won't do the red because that one's been used already. But there are enough colors in the rainbow, let alone the color packet in our Crayola boxes, that they could have easily done this in such a manner that we would have had plenty of options so that there would reduce the chances of there being an error. How many kids will be given an adult dose? How many adults will be given the original vaccine when they were hoping to get a booster? Who knows, right? We don't know. Now, not all clinics have the capabilities of having different storage areas. One solution can be, we'll put one in one refrigerator, one in the other, but a lot of facilities don't have multiple refrigerators. And many of the bigger clinics could have a second person verify that the right vaccine is being given, but a lot of small clinics don't have the ability to do that as well. So what could possibly go wrong? Now, finally, in the confusion realm here, and this is something that just came out in the last couple of days. So the White House is now saying that people should not wait in order to get the booster vaccine. No further clarification. Yet the CDC says that a person should wait at least 2 months from when they got their last vaccine before they get the booster. And they also are suggesting waiting at least 3 months after a person had COVID before giving this booster vaccine. And we also know lots of studies have shown that antibodies protection has been there for longer periods of time. So it's been 3 months if since COVID BA5 started showing up, and so we're already past there. But if somebody had BA5 back in the earlier part of the summer, I can't imagine that they're not going to be protected. So, but we do not know, of course, and of course, nobody knows for sure if they had BA5 or not. Based upon the timing. Nowadays, we know because it's almost exclusively BA5, but there was a point where we just did not know. Okay, so with all of this confusion, all of this messaging, is there any doubt that this is going to lead to more hesitancy among people in the community? I don't see how it wouldn't. But, I'm the optimist here. At least there's one good thing. At least we didn't pull the stupidity of Europe, which decided to go forward with the booster that is the BA1 vaccine, which, as we just mentioned, is no longer in circulation. So maybe it will provide some extra benefit for people because it was an Omicron. But what did we see? People who had Omicron early, at BA1 early, in the year, weren't being protected from catching COVID over the summertime. So will that vaccine, probably this vaccine in America will probably do something more than what's happening over there, but nonetheless, it's still kind of a mess. Anyways, hope this was informative for you. If you're not a member of our and haven't subscribed to our YouTube channel, please do so. Please share the love with everybody. Join us on our Patreon account. Thank you to our new subscribers there as well. Have a great day. If you like what you've been seeing, please hit the subscribe button.